Hi Susie, back for round 2. So you need something like this. This is Free Up Cream, a professional massage cream, or a lotion that's not too oily, because you're going to use this now for what's called skin rolling. And skin rolling is very important to work the connective tissue and decrease something called the somatovisceral reflex. Soma means skin, viscera means organ. And when this reflex is in play, it's going to promote inflammation on the organ level. So in your case, that's within the gut. Okay, so the colon and anything else, it can relate to the bladder, it can relate to the uterus, it can relate down to the vaginal area. Okay, so I know we talked about possible endometriosis, if there's an inflammatory component going on, if you do have endometriosis, then this is a technique that is going to be very beneficial for you for that as well. So if we zoom down now to the abdomen, what you do is you take your lotion and you spread it on your hands. I'm using gloves so you can really see the difference between my hands and Allie's belly. And the first thing you want to do is start up higher where the rib cage is. And you gently want to pick up some skin, where you're going to use the skin as an anchor to release and mobilize the connective tissue that lies deep to the skin. And as you can see, my fingers are gently walking and my both thumbs are rolling underneath this wave of tissue here to mobilize it. And when you get through sticky areas that feel tight or restricted, it's going to feel uncomfortable. And if it's too painful, I want you to just, instead of continuing to roll, just stop and just gently lift the tissue like I showed you in the other video. And maybe we just do some gentle pulls with the fascia. We can pull down, we can pull sideways, we can pull in a diagonal, we can pull up. In fact, what you want to do is you want to just feel as you pull each direction, which direction is the most restricted, or which direction actually might provide the most relief. Okay, so let's go through that again. Let's start up here at the top. I'm gonna be at the rib cage. I'm gonna lift the skin to bring the fascia up and away from the muscle that sits below it. I'm gonna walk my fingers down towards the pubic bone. My thumbs are trying to get underneath the tissue to mobilize that tissue. You doing okay, Allie?
Yeah.
As we get down. Now, I don't have to just go this direction. It's probably easiest for you as the patient, self-treating, to go in this direction. But I could also come in a diagonal like this towards the belly button. I could actually come across the body like this, out towards the hip. I could come down just right inside the pelvis and come over above what we call the pubic bone, suprapubic region, in through here. This, you can see Allie's getting a little bit of redness here, so this is a histamine release, and this is a byproduct of the cell. It's not a bad thing, we just want this released. So again, working with this will tap into that somatovisceral reflex to decrease inflammation deep on the organ level, and this is good for you, whether it's the inflammation on the gut level or the uterus or the bladder or the vagina. So we want to do this throughout the entire abdominal wall. On this side, I'm going to skin roll up just to follow the ascending colon over through here. Good. All the way up to the rib cage. Okay. And then I can actually do a backward skin roll coming across here. She's a bit tight here. You can see if you can't pick it up, that's because it's tight. So I would use one of the cups that we showed you in the last video to lift this up. Or we really try and just get this lifted with our fingers as we come over. Okay, so we want to skin roll through the abdominal wall, and then we also want to skin roll, which will be a different video, below the pelvis on the inner thighs down here. And we'll show you that in a different video. Okay, happy skin rolling.